Good afternoon and welcome to the Ayurvedic Association of Canada's webinar presentation this evening on hypothyroidism. So if you are new to the Ayurvedic Association of Canada, we are a nonprofit that is spreading the word of Ayurveda across North America, especially Canada. And we're always looking for new members. So if you're interested in becoming a member, you can go to our website, Ayurvedic Association of Canada.ca, and look at our memberships. Suqueen is, hello? Suqueen, I'm Erica. Welcome to the webinar. Nothing. Maybe she can't hear me. So we'll start in a few minutes. I'm just so happy to have this presentation. Oh, we don't have a microphone. Well, welcome. Thank you. I'm so happy to have this first presentation. We've had quite a bit of a hiatus from our webinars, and we have an amazing speaker this evening on hypothyroidism. I'm going to let her introduce herself. Hi, Jajashri, how are you? Oh, here we go. Hold on. Hello, everyone. Welcome to the Ayurvedic Association of Canada webinar. If you'd like to turn your video on, you can. If you choose not to, that's fine too. Hi, Jajashri, how are you?
Hello,
Nice
Jaysha, madam.
You're looking great in blue.
Yeah.
So if anybody is new to the Ayurvedic Association of Canada, welcome. As I said, we are restarting our webinar series. And we will be starting in about 5 minutes. So we'll give people time to come. If anybody would like to say where they're from, please turn on your mic and tell us what part of the country you're from. I'm from Kelowna, British Columbia.
Hello, I'm Nancy White. I'm from Telkwa, British Columbia. It's kind of central BC.
Say again where you're from, Nancy?
It's Telkwa, BC.
Telkwa, okay.
Yeah, it's by Smithers.
Oh, by Smithers. Oh,
yeah.
Welcome.
Yeah. Sorry, I'll get my camera here. Oh, my light is very bad. Sorry.
You were on our webinars before, weren't you? I've seen your name before.
I don't think so.
No?
No.
Oh, well, welcome.
Thank you.
I'm Erica. I'm a director for the Ayurvedic Association in Canada, and I'm the host this evening.
Nice to meet you.
Nice to meet you. Anybody else like to tell us where they're from? We have somebody from Nebraska. It's amazing how people can find us all over the world.
Hello, I'm Sandeep Jassal. I'm from Surrey, British Columbia.
Welcome, Sandeep.
Yeah. How are you doing?
I'm great.
Great. I had a series of workshops today. So since morning, I've been sitting in front of my computer and not done anything else.
We all have those days for sure. So welcome.
Hello, everyone. I just wanted to introduce myself. So I'm Eva Maravan, and I'm the PR and Communications Director of the association. I mean, I'm one of them. And I'm very happy to be here. I'm sitting in a coffee shop, so I will be turning off my video. I hope you don't mind. But I'm here and I'm listening.
When we start, everyone will turn off their videos and their audio. There will be no other people on the screen. So welcome.
Great. Awesome. Thank you, guys.
Sue, hi, how are you, Sue? Sue's a friend of mine from a doctoral program, and we do case studies together and stuff. So sorry to put you on the spot, Sue, but thanks for coming.
You mean me?
Yeah. I do mean you.
Everybody. I'm from
There's not many of you.
no. I'm from Puyallup, Washington, which is by Tacoma, just south of Seattle. So not very many people have heard of it, but that's where I'm from.
I've been to Tacoma. I know where it is. My name is Orshi, and I'm in Coquitlam, British Columbia, and I am the other Director of Communications and PR for the association.
Welcome, Archie. Would anybody else like to introduce themselves, or you don't have to? It's
I'll introduce myself. I'm Jayashree from Surrey, BC. So I'm neighbor to Sandeep and very dear friends with Suzanne for many, many years. So
really
very
Oh,
happy
that's
to
right.
be here.
So
From
sweet to
Puyallup.
see you. Yeah.
Yeah, lovely. And that I know Telqua River well, the rapids of Telqua River.
it's a small world.
Oh yeah, for sure.
I can't get everybody on one screen.
Hi, and I'm Alina. Hi, Erika. We've met at the conference, and I'm studying at Yoga Veda Institute to be an Ayurvedic practitioner, and I'm from Calgary, Alberta, and I take internship classes with Jayashree.
Welcome. Thank you for coming.
Mhm.
Are you loving Ayurveda?
Oh, absolutely.
Yeah. All of us do, or it's kind of an addiction, a really nice addiction, I think. I'm trying to get everybody on the screen. Hold on.
Go to gallery view. I've got everybody on the screen.
Yeah, I had it on gallery view, but it doesn't show everybody.
Oh,
Anyway, so welcome. And I'm going to give the mic to the premier speaker this evening. And I will let her introduce herself and all her great credentials. I've just met this fine, wonderful doctor a couple of months ago. So would you like to take over?
Sure, Erica.
Hold
Welcome,
on.
everyone.
Can we all turn our videos off, please? And our audios? Perfect. And then I'll put it on, and your audio. We will be able to ask a few questions at the end. If you have questions you would like to put in the chat box, you can do that, and I'll read them out and we'll answer them at the end.
Okay, welcome everyone for the webinar series. I would like to introduce myself. I am an Ayurveda practitioner having almost 15 years of practice in Ayurveda field. I am an MD Ayurveda and actually pursuing my PhD in hypothyroidism. I met Erica in the AAC meet recently, and we discussed a lot about Ayurveda, lot of things, lot of principles about Ayurveda, and I came to know that she is a wonderful person, first of all, and also her success stories we discuss about. And there we decided to, head ahead and start this kind of knowledge sharing, so that we all can benefit from each other, and we can continue learning, because Ayurveda learning is a lifelong process. You all know that, right? Most of them are Ayurveda practitioner and who are actually keen to learn Ayurveda more and more. They are actually thirsty, right? So now I'm sharing my screen for the actual presentation. I hope that all of you are able to see my screen, right? Okay, welcome all of you. I was a professor back in India, recently moved to Canada, and I'm running my own clinic, Maple Leaf Ayurveda, where we are providing online and offline consultation, Ayurveda consultation, as well as the Ayurveda learning courses, which are yet to be launched. So now we move towards our actual topic, that is hypothyroidism. Basically, it's Ayurveda perspective. So before moving to, deep diving into the Ayurvedic perspective, I want to explain a little bit about the modern aspects of hypothyroidism so that we can, thoroughly understand hypothyroidism in a way, right? So before moving on to the actual topic, you can see that what is the word meaning of hypothyroidism. So it is very clearly state that hypo and thyroidism is, there is a hypo is little lower side, or it is little lesser side, and thyroidism, which is related to actually our thyroid gland, which is situated here. You can see it is situated just below the neck and covering your windpipe. So, oh, so sorry. Okay. So let's move to the actual how the thyroid system works. So thyroid gland usually secrete two hormones called T3 and T4, triiodothyronine and thyroxine. These are the two hormones which are very important for body metabolism, growth, and development. But how it generates from thyroid gland, it is depend on the secretions which are secreting from the pituitary gland, which is situated at the base of the brain, base of the hypothalamus. And there is another the hormone which is called as thyrotropin releasing hormone, which is actually very important in case of releasing the TSH, thyroid stimulating hormone. And thereby this thyroid stimulating hormone from the pituitary gland, it stimulates the thyroid gland to produce this T3 and T4. Wherever in our body there is a need of T3 and T4 arises, and wherever the T3 and T4 level decreases, this negative feedback, it generates the TSH from the pituitary gland, and it increases the T3 and T4 level into the body, like from the thyroid gland, and thereby the system, it continues in the body, so that the metabolism, all the activities actually in the body, it is responsible for because of the T3 and T4 levels. So before moving on to the actual topic, I want to introduce you to the different kinds of thyroid disorders. There are different kinds of thyroid disorders are there, which are actually based on the level of thyroid hormones into the body. So because of the certain reasons, because of the certain conditions, what happens, there may be, there are three categories: the functional, non-functional, and the infectious condition, which is called as thyroiditis. So what are the functional conditions? So in functional conditions, there is either the excess amount of hormones, that is the thyroid hormones, or else the lesser amount of the thyroid hormones. When the excess amount of thyroid hormones generates into the body, it causes, because there is excess amount, the major amount of the thyroid hormone secreting from the thyroid gland. That's why it comes under the hyper means the excess amount of thyroid hormones. So hyperthyroidism may occur, or wherever the deficiency or less hormonal secretion is there, that time the hypothyroidism condition may occur. Most of the time in general public, what happens, the autoimmune conditions, it aggravates those conditions. For example, grave disease and Hashimoto's thyroiditis are very common conditions you will find in and around the world, right? And then they are also categorized into primary and secondary on the basis of its chronicity and its levels, right? And that we will discuss it later. Okay, just a second. Sorry for the disturbance. So sorry for the inconvenience. Okay, so where we were, that functional conditions because of the thyroid levels, thyroid hormone levels, and there is structural condition that is called as non-functional thyroid conditions, which are goiter, tumors. There will be nodules present in the thyroid gland. It can be categorized into the non-carcinogenic or carcinogenic conditions. And thyroiditis, it is infection of the thyroid gland, which can cause the decrease and increase of the thyroid levels, right? So these are just a little bit of information about the thyroid disorders. Now move on to the particular topic, our today's focus on hypothyroidism. So what is hypothyroidism? I'll be introducing a little bit of hypothyroidism modern point of view. So we can see there are a lot and more cases are coming day by day, that there are a lot of cases increasing of hypothyroidism. Why? Because of the lifestyle we are following, the sedentary lifestyle we are following, right? So there are nearly 1 in 10 Canadians are suffering from hypothyroidism nowadays, majorly thyroid conditions. Either it may be hypothyroidism or either it may be a hyperthyroidism or any other conditions. And secondly, the females are on the higher side. The females are suffering more than the males. Why? Because we go through menarche, we go through pregnancy, delivery, menopause, so much hormonal imbalances happening in our life. So that's why the prevalence of hypothyroidism are much more in female than the male. It may be secondary to other conditions. It may be like diabetes mellitus or any endocrine diseases, any deficiencies. Because of that also, and to it may be secondary to the drugs which are taking, which are like amiodarone or maybe lithium, certain because of the certain medications also hypothyroidism may develop. Perhaps the most famous persons in the world are also suffering from Hashimoto's thyroiditis. For example, Oprah Winfrey, Hillary Clinton, Gigi Hadid. There's a lot more persons are suffering from this hypothyroidism nowadays. And I came to know that the Canadian government is actually providing disability for hypothyroidism. They are providing a benefit for this. So move on ahead. That now I'll explain a little bit about hypothyroidism. That what is hypothyroidism? I already explained that there is a less secretion of thyroid hormones, and thereby what happens? Its functional level. It's because of the thyroid, because of any conditions, because of maybe nodules, because of there is atrophy, or because of any obstructions, or because of iodine deficiency, there is less secretion of thyroid hormone into the body. This usually modern science says that it is progressive and it is irreversible. Not in case of Ayurveda though. But they say that complete supplementation of thyroxine can, maintain the life of the person. So what are the causes of the hypothyroidism? Basically, I explained you in the worldwide, the major issue of hypothyroidism is iodine deficiency. Iodine, what happens when in the blood, from the blood, iodine enters into the thyroid gland. There is thyroid globulin which binds the iodine, and thereby it actually produces T3 and T4. Right. So if the iodine deficiencies are there, there are no more of thyroid hormone secretions, the development of the thyroid hormones. That's why iodine deficiencies are the major issue, and that's why in the different parts of world there are countries where iodine deficiencies are more common. Secondly, the inflammation of the thyroid gland also can cause the little amount of reduces the amount of thyroxine. And if there is complete or partial removal of thyroid gland, maybe because of some other issues, some thyroid infections, some goitrous conditions or carcinoma or whatever, or else if unfavorable environment is there. For example, if somebody is taking radiation or somebody is working in the environment where the constant constant exposure to certain chemicals, then also it may harm the thyroid gland. If there is an anomaly from birth itself, the thyroid gland has not developed properly, the radioactive iodine therapies also may cause trouble to the thyroid gland. There are some drugs which also depresses the thyroid function. And also if the problem is there in the hypothalamus or pituitary, right? That we will discuss later, because step by step the primary, secondary or tertiary hypothyroidism will be there on the basis of where the lesion is. So on the basis of, as I have told you, that on the basis of where the problem is, for example, if the problem is in the thyroid gland, or else problem is in the pituitary gland, or the problem is in the hypothalamus, where the lesion is, it has been categorized under primary, secondary, and tertiary, or central, we can say, right? So primary, most of the time, because the problem is in the thyroid gland, it is not secreting proper amount of thyroid hormones. That's why what we will find is there is less amount of thyroid hormones, but there is increased amount of TSH level, the thyroid stimulating hormones. Right? This is a normal negative feedback happens in the body when thyroid gland releases the T3 and T4. When the body are deprived of T3 and T4, it causes negative feedback, and it signals the pituitary and hypothalamus to secrete more amount of TSH just to compensate this T3 and T4, right? But sometimes what happens, because the thyroid gland is not able to produce much amount of T3 and T4, there is increased level of TS and TRH, but because it is not producing properly, there is less amount of T3 and T4 you will find in the person's report, right? Hashimoto's thyroiditis, it is an autoimmune condition. Autoimmune means what? Our body immune system is against our body tissues. So what happens this in autoimmune thyroiditis, it's chronic autoimmune thyroiditis, it actually destroys the thyroid gland tissues, and thereby the production of thyroid hormones decreases. Most of the time it may be goitrous, there will be nodules, or it may be atrophied condition. Anything will be there, right? And sometimes it is associated with the other condition, for example, diabetes mellitus, especially type 1, and Turner's or Down syndrome. There are congenital malformations also may present since birth, and because of that the thyroid gland has not been developed properly, and that's why the production of thyroid hormones are lesser in the body, and that's why the other symptoms may develop. That condition is called as cretinism. Iodine deficiency are the major issue, and iodine deficiency is responsible for endemic goiter and cretinism, but is an uncommon cause of adult hypothyroidism unless the iodine intake is very low or there are complicating factors such as consumption of thiocyanate in cassava and selenium deficiency. Secondary hypothyroidism, as I have already mentioned, that primary hypothyroidism where the problem is in the thyroid gland, but secondary hypothyroidism, there is a problem in pituitary gland. It may be nodules or something like that, which is causing pituitary to not produce much amount of TSH. That's why in secondary hypothyroidism there is less amount of TSH level, as well as because the thyroid stimulating hormone is not secreting properly. That's why T3 and T4 levels are also lower in this case, right? Tertiary, again, there is a pituitary hypothalamo excess is there. The problem is in the hypothalamus. There may be any tumor, any other conditions. Because of that, the hypothalamus is not producing proper amount of TRH, thyroid releasing hormone, and that's why there is less secretion of TSH in the body. There may be tumors and any destructing kind of lesions, something like that, right? So now move on to the symptoms. What are the symptoms you will find in the hypothyroid patient? During my study, I have seen lot number of different kind of symptoms person are feeling. There may be not all the symptoms are present. Sometimes, little 3 or 4 symptoms will be there. Sometimes there are all the symptoms you will find in a person, or sometimes the degree of the symptoms also will vary according to the person to person. So majorly you'll find weight gain in the person, even though he or she is exercising daily or not eating much food. Though the weight, they increases weight, and even though they are doing a lot of exercise and everything, cardio and everything, but they are not able to, reduce the weight. Cold intolerance is very common. Then persons are usually depressed. The metabolic rate is low. That's why the heart rate is little low. There is mostly, sometimes you'll find the swelling on the neck region, then hair fall, then constipation is very common in this kind of patients. Then their concentration is not low in concentration. They cannot focus properly because of the metabolism is low. It hampers the brain system as well, mental conditions as well, right? And there are a lot more other symptoms like the hair loss in the eyebrows as well, dry scaly skin, swelling sometimes. Then also because of this condition, sometimes infertility, PCOD, stress also you'll find in this kind of patients majorly. And myxedema coma, I'm just mentioning this myxedema coma. It is a severe condition of hypothyroidism. It actually an emergency condition in hypothyroidism, where you'll find a lot of edema and bradycardia. There is gasping. The person is not able to breathe properly. Sometimes unconscious, and because of it is a severe condition, you have to take to the emergency. So during screening, you have to consider some of the point that whether the person is suffering from other conditions or not. For example, they are suffering from diabetes type 1, any malignancies are there or not, psychiatric conditions are there or not, and certain deficiency or certain other thyroid related surgeries has been done or not, or whether they are taking amiodarone or not. So the person who are having these conditions usually tend to develop hypothyroidism a lot. So you need to screen those kind of patients frequently. During diagnosis, to diagnose hypothyroidism, it is necessary to do the thyroid profile. TSH level and free T3 and T4 level are very important to understand what kind of thyroid condition that person is having. So I need to consider some of the things. For example, here I have just put a little bit understanding how you can diagnose on the basis of the free T4 level and TSH level. So if everything is normal, person is euthyroid, but if it is the TSH level are on the higher side and the T4 level are on the lower side, that is a primary hypothyroidism. But if it is the T4 level are on the higher level and TSH on the lower level, there is primary hypothyroidism. In secondary hypothyroidism, which is related to pituitary gland, both the levels are in the lower side, but if it is on the higher side, you can consider the hyperthyroidism, secondary hyperthyroidism. Subclinical hyperthyroidism and subclinical hypothyroidism are the initial stage you can consider, where a little milder side of hyperthyroidism and hypothyroidism you will see symptoms of those things you will see. So now move on to main topic, that is medical management. According to modern, what kind of medical management they are doing? They are doing replacement therapy of those hormones. The thyroxine replacement therapies are very common. That it can actually reduces so many symptoms, but in a long run, I have seen some of the things that person may develop of some other deficiencies. Person may develop of certain other conditions as well. So synthetic form of thyroxines are available in the market in the form of levothyroxine. They are very beneficial in terms of modern science. And basically, it is very important to maintain the thyroxine level during pregnancy, because the fetus is growing. The growth hormone are much more needed in this particular pregnancy cases. So there are thyroxine replacement therapies helps in those conditions. If hypothyroidism occurs in a major conditions during pregnancy or before pregnancy, it may cause infertility. During pregnancy, if it is developed much more, then it may cause miscarriages. It may cause preterm delivery. It may cause lower birth weight, etc. So as I have already mentioned you, that whenever you are seeing some kind of symptoms, some kind of major symptoms mentioned in the thyroid condition, you should also think about anemia, B12 deficiency, iron deficiency, chronic kidney conditions, depression, anxiety disorders, liver conditions or sleep apneas, some viral infections also, and vitamin D deficiency. So this can be your differential diagnosis. So now move on to the basic topic of our today's center, that is Ayurvedic perspective. What is the Ayurvedic perspective? Before moving deep down into this topic, I just want to highlight a little bit about, most of you are Ayurveda practitioner and you may know certain things, certain basic things, dosha, dhatu and mala. So doshas, our Ayurveda has explained our body in a way that there are some components in our body has been categorized like vata, pitta and kapha. So I'll just in generalize, I'll categorize those things. Vata can be correlated with our nervous system. Pitta can be correlated with our hormonal or as enzymatic activities. and kapha is more stable, which is can be correlated with the stable and secretory system like lymphatic system, or as any kind of stable or structural conditions, structural things. So it is actually not let's not stick to these terminologies only. It is having a more wide perspective in terms of understanding. So and the dhatus, rasa, rakta, mamsa, meda, asthi, majja, and shukra. So those are the dhatu is dharanati dhatu. So which is holding our body. The muscles are holding our body. The bones, bone marrows, the blood circulatory system, everything is holding our body. So those are categorized under dhatus. So when we are talking about hypothyroidism, we should understand this basic thing first. So what happens in hypothyroidism? Basically, it is primarily it is under active Agni. What is Agni? Agni is a digestive fire. It is not limited to only digestive fire. It's a fire which is present in stomach. It is also present at the tissue level. It is also present at the different micro metabolic activities, which is happening due to this Agni. The digestion process is happening because of the Agni, but at the micro level, if we see, the digestion happens also in tissues as well. It is not only limited to our jathar or only related to stomach. So here what happens in general, the Agni is lower, whether it is Jatra Agni, that is digestive fire, whether it is Dhatu Agni, the Agni, the fire which is present at a tissue level, it is also lower. And that's why the metabolic system has hampered, metabolic system has slowed down, right? So what happens, the Agni in this condition, the Agni is low. The Agni at Dhatu level inhibits by multiple hetus, leading to diminished Agni Vyapar in the body. Just because of the sedentary lifestyle, just because of the certain food habits we are taking. Maybe we are taking heavy substances, maybe we are taking cold substances, and thereby it increases kapha, which is having the similar properties of the whatever the items we have taken, we have consumed, right? So what happens because of that, there is obstruction in the channel, and the Agni has hampered, the fire has hampered, not at the level of digestive fire, digestion level, but it has hampered at the level of tissues. And that's why the lower Agni, the lower fire has diminished the Agni Vyapar. The overall activity of the body is slowing down, not only your digestion, not only you are constipated, but because the Agni has decreased, the other metabolic activities has lowered down. And because of that, what happens? So one system is connected to another system is connected to another. So that's why because of there is blockage due to that heavy, due to that manda, slow activity, slow metabolism, the other system get hampered, and because of that, there is not much circulation is going on, right? Because if, for example, if we are taking a pipe which is flowing the water, if you put some obstruction in between, what happens? The flow will stop, and that's why the pipe which is actually supplying the water to the one apartment, it has stopped, and that's why the other apartments are not having that water now. So because of that, the obstruction, the sangha, which is called as sangha, because of that, what happens? The other system also gets slowed down. And what happens? Because here is a flow, the flow is coming, but there is a sangha, there is an obstruction. What happens? It will, there is a vimarga gaman in the sense, it will go somewhere else. It will try to go some other other areas, right? So there is a Sangha and there is a Vimarga Gamana. This is a main samprapti of this hypothyroidism. And because of this multiple, because of one channel has obstructed, because of that the other channels are also hampering. Because of the multiple Srotas involvement, it is the dhatu, all the dhatu functions, not only one dhatu, not only one tissue, or not only one system is hampering. Now the other systems are also hampering because of that, right? And because of that, what happens? The polydhatu, like many dhatus are involved, and because of that, different dhatu rasa get compromised, leading to both physical and mental features in hypothyroidism. Because it is not limited to the body system, it is also related to the mental status. If I'll say that because of there is obstruction or there is a trouble in the thyroid gland, there is a less amount of thyroid hormone, which we can take it as Agni, right? Fire. And because of that, the other systems are slowing down because not proper amount of thyroid hormone is secreting, and that's why all the systems one by one it slows down. That's why you'll find the bradycardia. That's why you'll find the less heartbeat, right? And because there is less metabolic activities in the body, you will feel low in energy. You'll feel coldness in the body, right? So Mandaguna of Kapha, basically we have categorized this Vata, Pitta and Kapha into certain gunas. There are typical gunas they have. So here the Mandaguna of Kapha is basically causing the Samprapti pathogenesis here. And that's why what happens, as I have told you, there is obstruction because of this Mandaguna of Kapha. There is what happens, the Vata get involved into it, because Vata is circulating throughout the body. Its function is to circulate throughout the body. It is actually responsible for all the activities in the body. Vata is basically important for all the activities in the body. But there is Kapha obstruction because of the Mandaguna of Kapha, and that's why what happens, the Vata becomes it combines with those Kapha, and that's why it says that it's samsarga combination happens. And because the Vata is having the Yogavahi nature, it's like it carries whatever is there with it, right? All the movements in the body are basically because of Vata. And this Mandaguna, or else if you can say there are toxic substance which has been developed because of the less digestive fire in the stomach as well as at the tissue level. Those toxins are not eliminating from the body and stays into the body, and that are carrying with the Vata, and they are lodging into different systems. And that's why the other systems are also now, because of all the toxins has been developed into the tissues, what happens, the other systems are also slowing down now, right? So dosha dushya samurchana happens here. So this is a pathogenesis, not only sharirik doshas, vata pitta kapha, but also the manasa doshas are also involved. Mainly tamasu guna. It develops the tamasu guna. It increases the tamasa guna. Because of the kapha and vata sanyoga, the combination of kapha and vata, and majorly it disturbs the rasa, rakta, and mamsa dhatus. And why? Because of the manda, because of the less activity into the koshta, into the stomach, or else at the dhatu level, or else at the tissue level. You should consider tissue level as well, not only at the digestive level but also at the tissue level, right? And as I have already mentioned, there is a sangha. Sangha is obstruction, and because of the obstruction there is vimarga gamana. The doshas will go here and there. It won't follow its proper path, right? and roga marga, because all the systems are now hampered. So all the margas are, all the channels are blocked, all the channels are now hampered. I hope you have understood this particular point. So when we see the Vikalpa Samprapti, we need to consider what are the qualities of Kapha and what are the qualities of Vata get hampered in this condition. So mainly because of Manda Guna, because of Shita Guna, and because of Guru Guna, this condition happens. So if the person is taking these gunas more in their dietary system, or else if they are following certain lifestyle which can increase these gunas, which can increases this quality. For example, some person having the sedentary lifestyle, just watching TV on sofa and not doing any other activities, or else they are following some dietary habits which are actually because of, even though their digestive fire is less, and they are putting some heavy indigestible substance into their body system, what happens, this gunas will increase. And I'll tell you one more thing very interesting later, that because of certain predisposing factors also present into the body, this condition may aggravate or may develop lately. There may be any genetical predisposition as well, that we will discuss later. Okay. So hypothyroidism as such has not been mentioned in Ayurveda directly, but you will find certain description of Kaphaja Nanatmyaja Vyadis here and there. So there are certain symptoms has been mentioned in our Samhitas. Specifically, certain symptoms has been mentioned. For example, Chitta Dushti, neurological symptoms. We can correlate it with depression, psychosis, etc. Pandutva is very common. Kaphaja Shotha, swelling, which is actually very common in iron deficiency or iron deficiency anemia. Chronic anemia also may cause Shofa or Shotha. Pandutvam and Shotha are very are having the similar sampraptis, and because of that, you can see because of less metabolism in hypothyroidism, what happens, the nutrients from the body is not able to digest those nutrients from whatever the food person is taking, and that's why what happens, the deficiencies develop. Usually iron deficiencies are very common, B12 deficiencies, vitamin D deficiencies are very common in those kind of patients later, even though they are on thyroxine replacement therapy, right? So Hridaya Upalepa, there is a atherosclerotic condition also may develop later. Dhamani Pratichayam and Dhamani Upalepam, because as I have already mentioned, there is toxins in the body, and it may lodge somewhere in the lumen of the arteries or veins, and they may cause some Hridaya Upalepa or Dhamani Pratichaya, the atherosclerotic condition later in life. Shvitra, Kaphaja Pandu, dry scaly skin, or else in later cases where the Shukra Dhatu get the Shukra Dhatu also affected, then infertility also may develop in this kind of patients. So what about the clinical targets as an Ayurvedic practitioner, what you should do, right? So here if we see, there is a less Agni Vyapara, there is a low digestive fire, so you should focus on digestive fire to ignite the digestive fire, whatever the herbs, whatever the things you can do, you should do that. Secondly, because there is a lot of toxin production, AMA production, we can say, because of the lower metabolism, because of the less Agni at the tissue level as well, there is a lot of Mala Sanchaya, there is a lot of toxins develop in not only in GI tract but also in the tissues. So what you need to do is you need to do some Mala Pachana, you need to do some you need to should do some give some Pachaka Dravyas as well. And there is the best way to remove all those toxins, that is Strotoshodhana. Strotoshodhana can be done with a Shuddhi procedure, like detoxification procedure like Panchakarma, Vaman, Virechan, etc. can be done. And obviously there are involvement of Kapha and Vata dosha much more. So you should give Kapha, Vata, Hara Chikitsa in those kind of patients. And also there is the involvement of Manasa dosha, especially Tamoguna. So Manoharshana kind of dravyas which are having affinity towards the which is having affinity towards the central nervous system, like Brahmi or Jatamamchi, etc. drugs also can be chosen. So Vamana is a procedure where we remove all the toxins from the upper part of the body. What happens, the Manda Guna, because Vamana actually reduces the Kapha from the body, and it actually it improves the Strotasa Marga. It opens up the Strotasas. So it is very much important to do Vamana in if the person is favorable to do Vamana karma. Virechan also can be done. Vamana, for Vamana, most of the time we are using Madana Pipili, Vacha, Acorus calamus, Yashti Madhu, Glycyrrhiza glabra, rock salt, and honey. Usually we do Vamana with this yoga. Virechan also can be done if the person is more of Pittaja kind of a person and is favorable for Virechan procedure. Nasya also, Tikshna Nasya can be given, mainly Shadabindu Tela or Gudadraka can be, that can be done. Certain external therapies like Shirolepa, Takradhara, and Udvartana. Udvartana has very good results in case of obesity as well. Triphala Udvartana is very good to stimulate the channels. It's very good. Internal herbs, so you can choose Tikshna Ushna Dravyas which are having sharp and which are having hot potency in it. Those dravyas like Varunadi Kashaya is very famous in treating hypothyroidism. Punarnava Gugulu, as Bohirvia diffusa, is having good action towards reducing the edema. So Punarnava Gugulu can be used, Kakamachi Churna and Vaishwanara Churna can be used. These are some of the preparation we were using during our clinical practice. Shiva Ghutika is also very good composition where Shilajit is used in this, where one of my senior was studying on that, and we got, I saw that there were good results in hypothyroidism with Shiva Ghutika. It is also having the Karshan property, and it can be used in obesity as well. Rasayanas are very important in case of chronic condition. Why? Because the condition has developed there are drugs or there are therapies where we cannot reach to deep to the deeper tissues. That time it is mandatory to give rasayanas after doing Shodhana procedure, so that we can reach to the deeper tissues and eliminate those doshas from the tissues. Secondly, rasayanas can be chosen on the basis of the prakriti, the dosha, basis of the dosha involvement, because different kind of rasayanas having different kind of benefits. And secondly, rasayanas having typical property that it reduces free radicals from the body and it rejuvenates the tissues. It is having the capacity to regenerate the tissues of thyroid glands as well. So rasayanas are very important. It can be given in a form of Shirapa, Grita, or any other Churna Kalpanas. On the basis of the Prakriti and Dosha involvement, you can choose. Certain rasayanas like Bhallataka Rasayana, Lashuna Rasayana, Chitraka Rasayana, Punarnava Rasayana, they are very famous. The Bhalataka is having the Kafahara and Stroto Shuddhikara property, and also Vibandhara. Vibandhara in the sense it is having it cures constipation as well. Chitraka is also one of the rasayanas. It is Chitraka is told as Deepana Pachaniya. Chitrako Deepana Pachaniya. So it ignites the digestive fire, and upon that it eliminates, not eliminates, it digests those toxins. Lasuna is one of the great drug of choice, but it is little bit of slimy in nature. So you need to think about, Tiksha in the sense it can penetrate through tissues, through channels. So wherever the avrana is there, wherever the covering is there, in those cases Lasuna can be used. Shilajitu is also having wonderful result, and Punarnava mainly can be used in conditions of edema. So to understand the treatment point of view, it is very necessary to do timely shodhana, because toxins, you may reduce the toxins through shodhana procedure, through purificative procedure, but because of the lesser metabolic activities, because of the less agni, still there is less agni, there will be the chances the person may develop ama or toxins again and again and again, right? So timely shodhana is very important in this condition, and mainly you have to focus on kapha and vata hara chikitsa, where you need tikshna guna, where you need ushna guna, where you need the gunas which can combat the kapha property mainly. But you should think about the person's strength as well, right? Whatever the person, on the basis of the person's strength, you can use this kind of treatment. So now if you see, there is a difference between hypo and hyperthyroidism, right? Mainly. So mainly this is, mainly in hypothyroidism, there is activity of thyroid gland is much more, and in hypothyroidism there is less activity of thyroid gland, and that's why you will find different kind of symptoms. For example, there is hair loss, there is bulging of eyes, there is goiter, rapid heartbeat, whereas here slower metabolism, slow heartbeat. In hypothyroidism, weight gain, whereas here weight loss will be there. Constipation will be more in hypothyroidism, whereas diarrhea may occur in hyperthyroidism. So here if you see, the pitta and vata involvement is much more, and here the kapha and vata involvement is much more. So whenever you think about the treatment aspects of this particular point, you need to refer the different gunas, the different qualities of the particular herbs you are giving or lifestyle you are suggesting, right? So this point I'll share it later, because 2 or 3 incidences are there with the COVID-19 and the thyroid hormonal level, which I experience in my patient conditions. So yeah, in my practice, usually I got good results with this formulation, which is having Gorakmundi, Kanchanara, Punarnava, Gokshur, Abragbhasma, Vangabhasma, and it is triturated with Amalaki, Amelia officinalis, and Ardrakaswaras. Mostly I got very good result by using this particular formulation. So there are certain yogasanas also you can prescribe, which can actually strengthen the thyroid gland. For example, halasana, then paschimottanasana also can be done. Setu bandhasana, then dhanurasana, where the activation of thyroid gland occurs, and Bhujangasana. You can massage also. You can advise a person to massage the thyroid gland and also some of the pranayamas, for example, Ujjayi pranayama, Brahmari pranayama, Kapalbhati. Those also are very useful in this kind of conditions. Not only you should focus on only on herb or only on medication, but it is very necessary to focus on the lifestyle of the person, because if they don't follow proper lifestyle, proper regime, the condition may come again and again. So it is better to advise herbs along with yoga, along with lifestyle changes and some pranayamas, and some daily routine has to be changed, some dietary regime has to be changed. Food which should be avoided, basically the fatty foods which are having much amount of sliminess, cheesiness, some foods which are heated in plastic. Alcohol may derange the digestive fire, and soya products also has to be avoided. Then bakery products, because it is having more of maida, more of the preservatives and all those things. You should avoid. Cruciferous vegetables has to be avoided, and certain beans has to be avoided in those kind of patients. What to eat now? So persons should eat iodine-rich diet, eggs, seaweeds, iron-rich diet, selenium-rich diet. Brazil nuts are very good. Hazelnuts are very good. Vitamin D has to be taken. Natural vitamin D, natural iodine, natural. So natural components has to be taken, not the supplements. I don't recommend much supplements. So vitamin A rich diet, and obviously the gluten-free diet has to be recommended. Certain points I wanted to actually discuss about this particular point. Basically, the slide we have skipped, that is the relation between the thyroid gland and the COVID-19. What happens actually, the virus could affect the pituitary gland. That actually happened in many of the cases I have seen. So COVID-19 also stresses, obviously the stress hormone and the thyroid gland are having the direct connection, because the TSH is producing from the pituitary, and pituitary is stimulated from hypothalamus. So there is a direct relation, right? Stress and thyroid. So high stress hormone levels such as cortisol were produced, and it reduces the production of TSH. I have already mentioned. So what I observe is during COVID-19, even though I was prescribing some of the herbs which were actually very effective before COVID-19, when I was prescribing the same herbs to patients, but later what happened, I saw that there were not, like, results were there, but not the desired result I could get. So I could think about this particular theory, that because of the much more stress and because of the virus effect, it has affected pituitary gland in a major amount. And I would like to say that the virus had the capability to do the fibrosis. So the lung fibrosis were very common during that time. And because of that, also because of the fibrotic changes in the body, certain modification I had to do, certain treatment which can cover fibrosis as well, that I had to do. I would actually mention that one formulation, a simple formulation, Triphala and Aranda, I gave, and it gave me good result in fibrotic conditions. So, and also I want to mention that, yes.
We'll have to wrap up in a couple of minutes, please.
Yeah, it's done. It's almost done. I want to mention that it also having the effect on menstrual system, and thereby it also can cause PCOD conditions. So you need to look into it whenever you are seeing PCOD patients. And yeah, direct effect of thyroid hormone with the stress. It is having the two-way effect, that stress and thyroid level may increase or decrease, and also because of thyroid condition, stress level also may increase, right? So this is all about hypothyroidism. I hope you got a little bit idea of hypothyroidism. Thank you all.
Could you please close your presentation?
Yes.
And we have a couple of minutes for questions. If anybody has some basic questions, please not pertaining to something you have going on with your thyroid. As you know, in Ayurveda, that's a very specific individual kind of chikitsa that we need to look at. But does anybody, would they like to put up their hand, just have a general kind of question that they would like to ask Vijay Danel? I have one then. So when you work with people that have been on thyroid medications, do you believe that they can stop those medications at some point, or does it depend on how long they've been taking them? Or is that not something that you would ever suggest? Because there's so many people on thyroid medication. I cannot believe how many people are on thyroid.
Yeah. So during my practice, what I was doing actually is because the thyroxine level in the bloodstream, it stays for a longer period, right? So and the effect of thyroxine, if you stop any modern medicine, let's say, if you stop it, it shows some withdrawal symptoms, right? So to combat those withdrawal symptoms, so what as an Ayurveda practitioner you should always focus on, you should not stop at that point itself, because to get that concentration of herb in the bloodstream or in your body, it will take time. It is not like that you have introduced the thyroxine and directly it starts, it circulates in the blood system and it starts showing effect. But in herb, in Ayurvedic practice, the herbs having different kind of affinity, right? So what happens when you take that herb, it digests, it goes through the digestive system, then it will circulate into the body, and it will try to cover the pathology. It is not replacement therapy. It is trying to heal that thyroid, so that the thyroid can produce the normal amount of those thyroxine levels, right? So to get cure that particular thyroid gland, it will take time. So during that period, you can continue with the dose with the same dose initially, but when you start seeing certain symptoms, for example, if I'll say you have, for example, if a person is on 100 mcg of levothyroxine, and if you have started your herbs to that particular person, so it will start to show that effect within 1 week or 15 days something, and the patient may feel little bit of other symptoms. For example, sometimes the hyperactivity or palpitation or something, you should tell them to stop, or else you can do one thing as well. I used to tell them to check their thyroid level every month, so that what happens on the basis of the level of the thyroid has been like the thyroxine level, you can reduce the amount of the thyroxine. For example, after 15 days, I'll tell them to reduce a little bit, like 75 mcg, and then we will continue with the same herb, or maybe on the basis of the symptoms, what kind of symptoms that person is getting. On that basis, you can choose the herbs and you can continue with the herb. And along with that, after a few months, again 1 or 2 months, you can again check the thyroid levels, and you can see how it has improved or not improved, like that, right? Because what happens, sometimes the condition is not properly diagnosed. It may be secondary hypothyroidism. There may be destruction of tissues. There may be some other underlying conditions. So during that period, you will come to know that that what are the other conditions are also there in the person with the thyroid condition. So you need to rule out, it's a long process. But if you are planning to do Shodhana therapy, then you should, during that period, you should stop that medicines, because persons, when you are introducing Ghrutapana, or when you are doing a Shodhana procedure, your Virechana or Vamana, it should not interfere. That thyroxine level should not shoot or should not come down like that. So because the thyroxine level will stay for few days. So it is okay if you are stopping for that particular period. It won't show that kind of, emergency effect. But after that, when the Agni is at the proper level, right? Just after Virechana, for example, you started some Samsajana therapy, where the digestive fire has increased and you are giving less food. That time you should consider the Agni as well as the Koshtha level. On that basis, you can introduce the thyroxine tablets to them. So it is very necessary to understand when you should, increase or decrease the level of thyroxine.
Thank
It is
you.
very necessary. But yeah, I'll say one thing, that at one point you can completely stop the thyroxine. You don't have to worry about that thyroxine tablet now. The person who is suffering from thyroid conditions are now only on herbs. And later also, here is the catch. You have to reduce the amount of herbs also you are giving, because at one point the thyroid gland is healing. There are few patients, actually I have stopped giving herbs as well to them, and they are totally fine. Their thyroid is gone, totally gone, right? So but there are cases, primary conditions, subclinical conditions can be cured easily, but secondary conditions and tertiary conditions, central hypothyroidism is not that curable. You can maintain the lifestyle of the person, and they won't develop other disease like diabetes or any endocrine disease later. So that's a win-win for them, actually, I have to say.
Very big win-win. Orshi, what, you have a question? Yeah, you need your speaker on, girl.
Yeah, very good morning to all. And I'm
Oh,
talking from.
Excuse me, I've asked Orshi first, and then you can speak.
Dinal, I have heard someone who has had such a hyperthyroidism that the thyroid span out so badly that it just shut down and went to the hypo end. Have you dealt with a case like that? And what would you suggest? Like, where do they start? Other than I will actually send the person to you for a consultation.
Actually, a very interesting point you have noted, that during practices what happens, because our body needs different amount of thyroxine or different amount of hormonal level in the body day to day, right? It is not same, like your body doesn't need same amount of thyroxine or same amount of thyroid hormone like it was yesterday, right? Because maybe your activity were much more higher and now it is lesser, and the environment also plays a different role. For example, in cold countries or in high temperate countries, it is different. So what happens in modern science, they try to follow one particular rule, that 25, for example, if they have decided 25 mcg of thyroxine is given to one particular person for a whole month or for 1 year, whatever, right? But they may not need that amount of thyroxine daily. So what happens? There is accumulation of that hormone, the synthetic hormone inside the body, which body doesn't need. So what happens? Sometimes the hypothyroid person converts into hypothyroidism condition, and sometimes the hyperthyroid condition patient turns into hypothyroid. There is a switch all the time, So Ayurveda doesn't work like that, right? it actually it doesn't focuses on thyroxine level, it focuses on Agni, and it is actually trying to cure this thyroid gland, which is actually affecting. It is not the replacement therapy which we are giving, because what I used to say to my patient then, when for example, if you are cooking daily and one day you stop cooking, you are like, okay, I'll take something from outside, and later also, second day also, you are doing something similar. Later also, you now tend to get habited to stick to the outside food now, right? So you become lazy. Now you don't want to cook up anymore. So our body is also like that. If you are supplying something from outside, our body organs, it says that now I am lazy. You give me from outside, I am not working anymore. So when you try to replace something from outside, your thyroid gland will say that I am not working now. Okay, whatever you want to give it from outside now. Okay, so what happens? But body doesn't need it, right? In hypothyroid patient, the thyroid replacement therapy, body may not need it, and you are dumping constantly. So it confuses the metabolic system, right?
I understand completely.
Yeah,
Thank you so much.
Yeah.
Thank
Okay,
you.
I'm going to, it's 1:15, so I have to stop the presentation. But I would like to thank Veji Dinel for coming and doing such a fabulous job on a presentation and
It's
answering.
actually my honor to speak in front of this many people, this many beautiful people, beautiful Ayurveda practitioners. Thank you so much. Thank you so much.
You're so welcome. Thank you.
Yeah.
So we do presentations once a month on a webinar, always the third Thursday. If you are a practitioner and you're interested in joining our practitioners forum, we have a practitioners forum at the beginning of the month on Thursday nights, where we had our first one and we just discussed Ayurveda in Canada and the issues that practitioners were having, and it turned out to be a fabulous discussion. So we will be doing that once a month. If you are not a member, you can come for one practitioners forum, but if you're coming on a regular basis, then you need to join the Ayurvedic Association of Canada as a member. So
This is actually, I would like to say that more and more people should come in our association, so that we can go forward and can take into a mainstream actually. So it is better, all of you whoever not joined yet, please join the Ayurveda Association of Canada.
And in the chats you have lots of thank yous.
Okay, thank you so much.
And yes, it is open to non-Canadians. We have also people from India that are so anywhere in the world you can become a member of the association.
Okay.
So thank you very much. And can you again say the name of your business so that everyone knows it?
Okay, we are running a clinic, online clinic, Maple Leaf Ayurveda, www.mapleleafayurveda, where you can find the online consultation as well as offline consultation and learning of Ayurveda principles. Though we are actually to launch the program, you can also contact me through hello@maple